Always come back to college on the Health2.0 Mumbai chapter. I head this chapter here in Mumbai. James is the chairman for Health2.0 India.
What is healthcare about? It's not treating patients. It's about helping human beings. Health 2.0 is the next frontier of medicine, of healthcare, where technology, health, services, social entrepreneurship, and human-centered design. This is the way we've defined it for India. So we need you guys to understand what is happening out there, because if you have heard of J&J and Merck and Biocon and Pfizer, and you haven't heard of Biosense, and you haven't heard of all these companies that are out there really innovating and doing amazing things, there's something wrong. Then you don't know all that you need to know. You'll get 99% in your marks, but you won't know all you need to know. And that's what we're hoping to decide. That's what we're hoping to share here in the next hour or so.
Protected, regulated, inside kind of a organization or creator. Social media is friendly, hi, hello, open, want to talk, but so that's where that gap is coming. You get the point. There are two different people. So when they are trying to come together, there are a lot of issues that are coming up. So these issues are currently getting resolved. In the next 2 to 3 years, you'll see a lot of changes that will happen.
It taught me how to integrate various platforms together and bring together one solution. Try to find a connect and just you will find a solution, an innovative solution, and who knows that solution can bring out a major change in the healthcare.
The seminar was really interesting. I mean, we never really thought that we could do so many innovations in healthcare. I mean, me being a doctor, all I knew is, you're supposed to go and practice. Apart from that, we didn't know anything else. So if we have platforms like this, we know that there are many more horizons that we can step on and explore.
Health2.0 is pushing all of us to look at the health in a much more broader perspective.
The last 2 years, I've been trying to get what you read in journals, on the web, in papers, to act out in real life. Whether it's in the slums, or whether it's with people who have means, then that's what this chapter is about. That's what the community is about enabling us to go do it. Other conferences can showcase products and showcase hype. We want that too, but we also want to show that these things are actually making a difference.
This is where you need to start. And that's when I realized that there's so many people out there, laymen and women like us, who don't understand these terms. How do we simplify it? How do we get them what they need? Diagnosis in a kit at home, fantastic. It's not pregnancy, it's cardiac disease. But how do we empower them? Help them get the right diagnosis in place, help them get the right medical attention they need without making it too complicated. So our goal, I think, in preventive health is to really empower a consumer, our patient, our caregivers, bring it out there to them versus making them reach out only when they're diagnosed with something or they have certain symptoms of a certain disease.
Healthcare at large, if you look, I think there are 4 pillars. I don't know if there are any other. We've got the pharmaceutical industry, we have the hospital industry, we have the diagnostic industry, and the medical devices industry. Preventive healthcare, for us, the need has been identified, the awareness is created, but translation to making people come forward to really adopt to those services, that change is for us marginal.
Poverty is kind of a complicated thing. You think, oh, you're born poor. But when you're dealing with a disease, that's not how it works. Many of my friends back in the States, someone in their family gets cancer, the family goes bankrupt. Well-to-do families, that is. if I was a non-compliant patient, how do you work with someone like me that's gone through 100 doctors, you've been through the system your entire life, you're given every medicine, every game, everything. How do you empower someone to do that? So that's what we're really trying to do.
Today, since everybody was saying that even an 8-year-old is on Facebook, as you mentioned. So this is where if we are able to touch the children, even if they are young, then we can make changes and bring about awareness and bring about changes in society.
There's this guy called Stephen Burnell who spoke at a conference yesterday in Stockholm. So he started his presentation by saying that we don't have a healthcare system. What we have is a dysfunctional sickness system. So the whole system is not geared to prevent. The whole system is geared to manage, and that's where the money lies.
I only get paid when someone comes to me for being treated. What sense does that possibly make? And that's why, one of the famous things is all doctors, when they die, will go to hell. Because we make our living on people's miseries, which is sad. And I think the only way to do that and the only way to change it is, the only thing is that though the health insurance industry in India is now, should have been fairly mature by now, they're still all scrabbling for market shares. No one's really talking about adding value or changing things. But I think hopefully once that change starts happening, things will become a little healthier.
We started working out, and after 14 months, we've come up with this cute looking device. So it's called Diabito. What it does is that this is a glucometer. It plugs into a glucometer and it wirelessly transmits the readings from the glucometer into your smartphone.
It's called U-Check. It is a urine analysis system. It basically reads a urine strip. I know many of you are familiar or not, but it's a strip which you dip it in the urine and it will tell you about 10 different parameters.
People are trying to relate to experiences, people are trying to Google information, people are trying to reach out to other person who's suffering from the same condition, and they're trying to look at what they feel about the condition, how they look at the condition, what are the solutions they are finding into it, and they're trying to relate to other people's life.
So knowing something about how pharma looks at health, how other emerging trends like new diagnostic techniques, new technological intervention, how they are changing the face of health industry is something I really discovered, which was very nice and which was very enriching actually.
Today, it's a reality that you have to acknowledge the fact that whatever has been working for last 100 and or maybe like 200 years, it still works, because the sales force we use, they are accustomed to those tactics or those tools. But it doesn't mean that something like social media or digital media is not equally effective.
What you have with many technologies available today is the multiple data, and nobody's there to interpret. Every time you have to go to doctor, even to get a suggestive diagnosis or even to get another test. I think that's where technology will play an important role, where it will trend your health, it will tell you what to eat, it will tell you which tablets are good for you, it will tell you the tablets cost, it will tell you which doctors are best in this area, everything.
The world is out there. There is a lot of conversation taking place on health in the digital and the social media space. The consumers or the society at large the world is getting smaller. The society is getting very well connected with each other. There's a lot of sharing that is happening. What is really important is how is digital and social media going to be integrated.
This is my second time to Health 2.0. Last time was good, this time is better. And I expect to see it growing every year, and I expect to be here every year.
There are a diverse group of industries that really came together for this seminar, beginning from pharma, the diagnostics, the medical device and the technology, and of course the hospitals and doctors. So which is definitely showing the way that this interest will change into action.
We engaged with over 100 students, and we saw a spark. We saw a spark start. Dinesh and I are going to plug those students who are very deeply committed and interested into some of the projects that are happening out in the field, in the real world, to see how their imagination can help us solve some of the biggest problems out there.